Hello to every smartness and midwives out there. Being a student or a clinician, Smartness Tutorial welcomes you to another teaching and learning session. Today, we are driving into one important or essential topic in nursing. But this topic is complex and tricky, which is what acid-base imbalance. Yes, we have already uploaded a comprehensible lecture on acid-base imbalance, but today we are reviewing this essential topic with NMC past question with simple and a comprehensible understanding or explanation. This will help to boost your confidence and get you ready for the next NMC exam or any other exams in nursing that you are going to sit. Okay, and so let's get started. Question 1. What is the normal pH range for arterial blood? A 7.35 to 7.45, B 7.55 to 7.65, C 7.0 to 7.49, and then D 7.50 to 7.60. So we are just asking you for the normal pH of a blood. All right. So this is so simple. What is your answer? What is your answer? The answer is A. Okay, so we said that the pH of an arterial blood is 7.35 to 7.45, and that means that the blood in our system is slightly what? Alkaline. Right, so let's move on to question number 2. Question 2. A mismatch between carbon dioxide and generation in peripheral tissues and carbon dioxide excretion at the lung is a condition known as ketoacidosis, B metabolic acid-base imbalance, and C respiratory acid-base disorder. So what is your answer? All right, this is so simple, right? So the correct answer is C. Okay, so let's go back to the stem of the question. You say a mismatch between carbon dioxide generation in the peripheral tissues and carbon dioxide excretion. Okay, so we all know that the carbon dioxide is responsible for generating and excreting carbon dioxide. So when there's a mismatch, it leads to what? Obviously not ketoacidosis, because ketoacidosis has to do with what? Type 1 diabetes. But when you look at the B and the C, you see they look similar, and that is also another trick that students needs to know. When the options some are similar, especially two are similar, it means that it should tell you that the answer is among those two options. And so when you look at the B, say metabolic acid base disorder, and then the C say respiratory acid base disorder. Now, the stem of the question is telling us about the lungs, and the lungs is for what? Respiration. Carbon dioxide is also has to do with what? Respiration. So that has to do with what? Respiratory acid base disorder. So a mismatch between carbon dioxide production and excretion affects ventilation and leads to what? Respiratory acid base disorder and not metabolic. Okay, because what the stem of the question is talking about is the lungs and carbon dioxide. Question number 3. The lungs responds to metabolic alkalosis by A. Decreasing the respiratory rate, B. Increasing the respiratory rate, and then C. Keeping the respiratory rate constant. So what is the correct answer here? Yes, A, B, or C? Is your answer ready? Put it in the comment section and give us your explanation. The correct answer here is A. Now, let's look at the stem of the question again. The lungs response to metabolic alkalosis. So here we are talking about someone is having metabolic alkalosis, how will the body compensate? So remember the regulatory mechanism we talked about in our previous video, how the body regulates the acid-base imbalance. We talk about the buffer system, we talk about the respiratory system or the lungs, and then we talk about the renal system. And so how will the lung respond when there is what metabolic alkalosis? So remember, anytime there's metabolic acid-base imbalance, the lungs has to respond. And when or the buffer system also can also respond. But when there is a respiratory acid-base imbalance, then something about the renal system also has to what respond, okay, and the buffer system. So now look at it, the options, the A and B also look similar, and so the trick that we talk about, decreasing the respiratory rate, increasing the respiratory rates, are similar. Okay, that means that the answer is in between the A and B. The only difference has to do with either the decrease or the increasing. All right, and so we say metabolic alkalosis means that there's much alkaline in the body, okay, which is bicarbonate. So how will the kidney compensate? Sorry, how will the lungs compensate? So in metabolic alkalosis, the lungs has to what slow down, okay, they slow down in order to reserve carbon dioxide. Okay, when they are reserving carbon dioxide, then they are increasing the acidity of the blood. Okay, they are increasing the acidity of the blood, or they are reducing the pH of the blood. Okay, all right, so let's move on to the next question, which is question number 4. Question 4: ammonia is excreted by the kidney to help maintain A, acid base balance of the body, B, low bacterial levels in the urine, and then C, normal red blood cell production. So what is your answer? Is it A, B, or C? Oh, what did you say? So now let's check the correct answer here. The correct answer is A. So what is the examiner asking us for? Say ammonia is excreted by the kidney to help maintain. Now I remember I said these are not my questions, okay? And so if I just pick it, but I think it's supposed to be ammonia is secreted, okay, by the kidney, because the kidney secretes ammonia, okay, in the renal tubes. Okay, so let's just assume that this is what the ammonia is secreted by the kidney to help maintain what is A, acid base balance. Okay, so the kidney secretes ammonia, okay, so that they can bind with the excess hydrogen ions in the body. And when the ammonia binds with the hydrogen ion, they become what? Ammonium. And that can be what? Excreted. Okay, so it means that when there's acidosis, the kidney compensates by secreting ammonia, okay, so that the ammonia will bind with the hydrogen. Remember we said that the higher the hydrogen, the lower the pH, and the acidic the blood becomes. And so when there's excess hydrogen, when there's acidosis, what the kidney does is that they secrete ammonia in the renal tubules. This ammonia combines with the hydrogen ion, they form ammonium, so that it can be excreted by the kidney. Okay, and that helps to maintain the acid base balance or correcting the acidosis. Okay, all right, now let's look at the question number 4. Another renal system here. So in renal compensation of acidosis, hydrogen ion secretion A decreases, and then the bicarbonate excretion also what? Increases. B, hydrogen ion secretion increases, whilst the bicarbonate excretion increases. Then hydrogen ion secretion increases, and then bicarbonate reabsorption also what? Increases. So what do you think is the correct answer? Hmm. If you have not watched the previous video on acid-base imbalance, kindly watch this video, because this will help you to understand this question and solve it so simple. Okay, so what is the correct answer? The correct answer here is C. Now again, we say when the renal system is compensating for acidosis, they will secrete hydrogen ion. Okay, now the bicarbonate, is it going to be reabsorbed? Is it going to be excreted? Let's look at the A. You say decreases. When we are decreasing hydrogen ion secretion, okay, then that means that we are not solving the acidosis. Okay, that means you are reserving the hydrogen ion that will increase the acidic nature of the blood. So the A is out. Now let's look at the B. We say increasing. So when there is acidosis, the kidney compensate by secreting hydrogen ion, which is correct. But the next one, which is bicarbonate excretion, also increases. Now bicarbonate, as we all know, is what alkaline in nature, and so if you are secreting, if you are bringing out bicarbonate, and you are also increasing your secretion of hydrogen ion, then you are not solving the problem. Okay, you are not solving the problem. Here the patient is having acidosis. There's high amount of acidity of the blood, and so you are bringing now the hydrogen ion, and then you are reserving an alkaline substance, which is what bicarbonate. So it means that the bicarbonate here will be what reabsorb, and this will help to compensate and to restore the pH of the arterial blood to normal, which is what the 7.35 to the 7.45. I hope you understand. If you don't, please get to the video and watch this lecture on acid-base imbalance. Now let's look at the next question. Respiratory alkalosis develops when respiratory activity does what? A. Decreased plasma partial pressure of oxygen to normal levels. B. Lowers plasma partial pressure of carbon dioxide to normal levels. And then C. Raises plasma partial pressure of carbon dioxide to normal levels. So what do you think is the answer here? Yes, waiting for your answer. 5 seconds. 1, 2, 3, 4, and 5. What did you choose? Is it A, B, or C? Now let's look at the correct answer. The correct answer here is what? B. Look at the question. You see, respiratory alkalosis develops when. So the question is just asking you for causes of respiratory alkalosis. You know, respiratory alkalosis is when there is excess oxygen in the lungs but less carbon dioxide in the lungs. And so let's look at the options here. Decrease plasma partial uh, pressure of oxygen. When the oxygen level is reduced, the normal level is 80 to 100. If it is reduced, then it means the patient is not having what? Alkalosis. Okay, but if it is high, then the patient is having what? Alkalosis. So that is not the answer here, because we are asking for what would lead to respiratory alkalosis. So let's look at the B. Lowers the plasma partial pressure of carbon dioxide to normal levels. The normal level for the PCO to the partial pressure of the carbon dioxide is 35 to what 45 meter per mercury. And so when the carbon dioxide is high, you all know that carbon dioxide is what? Acidic compound. So when it is high, then it means that we are having what? Acidosis. But when it is low, then it means that we are having what? The alkalosis. But let's look at the and so that means that the correct answer is what? B. Okay, before we get on, now let's look at the C. So we say C raises plasma partial pressure of carbon dioxide to what? Normal levels. When the carbon dioxide become normal, it means the acid base is also what? Balance. So the correct answer here is what? B. Okay, we said carbon dioxide is acidic in what? Nature. So when it is low, then it means that the oxygen level is also what? High. Okay, so we say respiratory alkalosis results from hyperventilation, which causes excess blow off of what? The carbon dioxide. So when you're having hyperventilation, you are getting alkalosis, respiratory alkalosis, because you are bringing in more oxygen and you are blowing off or you are reducing your carbon dioxide in the lungs, and that will help to what reduce the that will help to what increase the what pH, okay, which will lead to what alkalosis. Okay, so remember, fast breathing goes with what respiratory alkalosis, because you are pushing in more oxygen, and the fast breathing you are bringing out excess carbon dioxide, and anytime your carbon dioxide reduces, then it means that the blood is becoming what an alkaline in nature. Okay, all right, the next question. 8. Madam Ejeni Boya, a 41-year-old, has vomited severally, is likely to be diagnosed of A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory alkalosis, and then D. Respiratory acidosis. So, what is your answer here? Is it A, B, C, or D? 5 seconds. 1, 2, 3, 4, and 5. All right, so the correct answer here is B. Now, let's look at the stem of the question again. Patient is vomiting, and vomiting, it comes from the stomach. And in the stomach, we have a compound there which is what hydrochloric acid. Okay, so you are bringing out acid, but the bicarbonate or the alkaline substance remains. That means that the ratio between the bicarbonate and the carbonic acid, there's going to be a decrease to the acid, whilst your bicarbonate remains constant, which is what high. So that means that the patient is getting into what alkalosis. And the reason why it is metabolic is because it's what vomiting. Vomiting is an issue of metabolism and not respiration. And that is why the answer is what metabolic alkalosis. So severe vomiting leads to loss of gastric acid, causing a rise in the pH, resulting in what metabolic alkalosis. So question number 9. Before seeing a newly assigned female client with respiratory alkalosis, the nurse quickly reviews the client's medical history. Which condition is a predisposing factor for respiratory alkalosis? A. Extreme anxiety. B. Narcotic overdose. C. Type 1 diabetes mellitus. And then D. Myasthenia gravis. So what is the correct answer here? Is it A, is it B, C, or D? The correct answer? The correct answer here is A. Now, let's look at the stem of the question. Before seeing a newly assigned female client with respiratory alkalosis, the nurse quickly reviews the client's medical history. Which condition is a predisposing factor for respiratory alkalosis? So all the question is asking for is risk factors for respiratory alkalosis. And we say respiratory alkalosis is what? Fast breathing. Respiratory alkalosis occurs when there's what? Fast breathing. You are breathing faster, you are bringing out carbon dioxide, and you are pushing in what? More oxygen. So what among these options will cause someone to breathe faster? Anxiety. When you are anxious, you begin to pant. Okay, that means you are pushing in more oxygen and bringing out more what? Carbon dioxide. But narcotic overdose will reduce respiration because it has effect on the what? The respiratory muscles. Okay, it depresses the respiratory muscles, and that will cause slow breathing, which will rather lead to what? Respiratory acidosis. And type 1 diabetes mellitus, we all know that it is what? A metabolic issue. And so here we are looking at for respiratory, which is out. Okay, and even with a type 1 diabetes, it leads to metabolic what? Acidosis. Myasthenia gravis, as we all know, has to do with what? A condition that leads to a blockage of the acetylcholine receptors. Okay, that means that there will not be nerve impulses. Uh, the acetylcholine will not be able to get to the muscles. Okay, and so if we talk about the muscles of the respiratory system, since we are not getting the impulses there, there's going to be what? A problem with respiration. Patient is not going to be able to breathe better, and that will lead to slow breathing. And so myasthenia gravis leads to slow breathing, and that can lead to what? Acidosis. Okay, all right, so now let's move on to the next question, which is 10. A female client with Guillain-Barré syndrome develops respiratory acidosis as a result of reduced alveolar ventilation. Which combination of arterial blood gas (ABG) values confirms respiratory acidosis? Oh, sorry, I've already shown you the answer. So A, we have so the answer is already being shown here, which is what? C. Okay, now let's look at the question. We are talking about respiratory acidosis, and so we want a pH which is less than 7.35. Now when you look at a pH of 7.40, which is above 7.3, that means that it is what? Normal, so that is out. Then B, pH 7.35, which is also about the normal level. Okay, now let's look at the pH of 7.25, and that is what? Acidic in nature. Okay, and then yes, the D also a pH which is what? 5, but 5 is not compatible with life. Anyone with pH of 5 is already a dead person. Okay, that is not compatible with life. So the answer now becomes what? The C. Now look at the partial pressure of the arterial carbon dioxide of the blood, which is what? 50 millimeter per mercury. We said that the carbon dioxide, the normal is what? 35 to 45, and the more carbon dioxide you have, the acidic the blood becomes. So it is more than what? 45, and that makes it to become what? Acidic. Okay, but when you look at the what do you call it? The D, the blood is the pH is low, which is acidic in nature, and then also the carbon dioxide is also less, which is supposed to be alkaline. And so that is also what? A mismatch. So if anyone is having this kind of figure, there could be an error of the machine or a typographical mistake, because this is totally a mismatch. Okay, it can happen. Let's look at the next question. Question 11. The nurse is caring for a client with nasogastric tube that is attached to low suction. The, the nurse monitors the client, knowing that the client is at risk for which acid-base disorder? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. And then D. Respiratory alkalosis. What is your answer here? Mhm. Is it A, B, C, or D? Yes. The correct answer here is B. Let's look at the question. You are caring for a patient with nasogastric tube, and you are suctioning nasogastric. So it means you are suctioning the GIT, specifically what? The stomach. So you are bringing out the content of the stomach, and we just learned that the stomach contains what? Hydrochloric acid. So it means you are bringing the acid out, leaving the bicarbonate, and that will lead to what? Alkalosis. Okay, and so since the acid is coming out not as a result of respiration, then it becomes what? Metabolic alkalosis. So we said nasogastric tube suctioning acid or is what? Taking out, changing the ratio of what? The carbonic acid and what? The bicarbonate. Okay, so this is so simple. Now let's look at the next question. Question 12. The nurse caring for a client with an ileostomy understands that the client is most at risk for developing which acid-base disorder? A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, and then D. Respiratory alkalosis. This is similar to what we just saw, and so I don't expect any of you to get this question wrong. You have to get it by all means. Hmm? All right, so I know you have already chosen the answer, and let's see the correct answer here. So the correct answer here is what? A. A client with ileostomy loses a large amount of bicarbonate through intestinal drainage, leading to metabolic acidosis due to decreased buffering capacity. Now, ileostomy, the ileo, what compound is of interest when it comes to acid-base imbalance is found in the intestines? It's bicarbonate. Okay, so a similar question can be: a patient is having profuse diarrhea. You are bringing out what? Bicarbonate. Ileostomy, we are bringing out what? Bicarbonate. So bicarbonate level in the blood will reduce, or in the system will reduce, whilst the acid remains the same or increased. Okay, and so since we are bringing out bicarbonate, then it means that the acid level remains constant or is increasing, and that will lead to what? Acidosis. So now we need to think about, is it respiratory acidosis or metabolic acidosis? Since they did not mention anything that has to do with respiration, then we go in for what? Metabolic acidosis. Okay, so always remember, bicarbonate is found in the intestine, hydrochloric acid is found in the stomach. Okay, so if you are bringing it out, if the patient is bringing those things substances out, either the nurse is bringing out or the patient is bringing out either by vomiting or diarrhea, then the opposite compound will go up, and so it will lead to either alkalosis or acidosis. Okay, so always remember this and never forget this concept. Thank you very much for staying with me. If you have not subscribed, please do well to subscribe so that the next video you'll be the first person to see it. Okay, make sure you comment. Okay, if you need a lecture on the ABG2, please let me know. Comment at the comment section for me, or anything that you need, just put it there for me, and Smartness Tutorial will attend to you. Thank you, and see you next week.